So let's go to a teenager now. So we're going from younger children, these patients getting older and older, and here was a young teenage young lady, and she didn't have a very broad smile, and she was kind of concerned about her kind of appearance here. And so she started with the appliance, and what we found is that the bone kind of tissue here became remodeled, the teeth became slightly more straighter, and her lip volume also started to improve. And so if you look at her teeth before the treatment was done, she had this kind of deep bite, but the top teeth are almost covering the bottom teeth. And she wore the top appliance to redevelop the upper jaw here, allow the bottom jaw to come forward, and you can see that the teeth are biting much more evenly now. You've got more tooth show on the lower arch here, on the bottom teeth, and that she has a nicer looking facial profile. And so the other thing we found is that the amount of jaw opening, because if the jaw is being held back, then the mouth opening is reduced, and if you allow the bottom jaw to come further forward, the mouth opening can be improved and increased. And actually what we need is about 48 or maybe 50 millimeters of opening of the mouth. We can measure that. And what we found in this case is that the amount of mouth opening improved as that bottom jaw came forwards. And it came forwards because the upper jaw was redeveloped, so there was a new functional space, a new space for the bottom jaw to move into to allow this correction to occur. And you can see the top jaw is looking quite nice, and in terms of the tooth alignment, the bottom jaw is looking quite nice. These teeth on the right and left side are kind of meeting as you'd expect them to do so. And from the front, it doesn't look too bad, and all of this was achieved without using any braces. And this patient was wearing the appliance late afternoon after school, in the early evening, and then all night when she's sleeping. She did not wear the appliance during the day. It's called a DNA appliance. DNA stands for daytime, nighttime appliance. You do not wear the appliance during the day. You wear it late afternoon, early evening, and all night. And here she is again. It's the patient that we saw with that kind of jaw, which is kind of too far back. By developing the top jaw, you can see the amount of bone development that's happened here. The lower jaw has come forwards. It's meeting the top teeth very nicely and producing a nice-looking lower facial profile.